welcome back to the Lifeworks Living Well podcast. I'm Mark Hennick. Dr. Reid Robison is an American physician and chief medical officer at Novamind, a leading mental health company enabling safe access to psychedelic medicine through a network of clinics and clinical research sites. He joins me now on Living Well. Reid, thanks for being here today.
Thanks for having me.
So I had a guest on the show a couple of episodes ago where he referenced the psychedelic renaissance that seems to be happening right now in the mental health research community in particular, which is a bit surprising to me in some ways, both given the history of psychedelic research from the 60s onward, as well as the fact that there's been otherwise relatively little innovation, I think, in the mental health treatment space in quite some time. Yet we've certainly been seeing this sector become increasingly popularized and commercialized, I think, in Canada for sure, as a viable treatment option for a variety of mental health concerns. So all that goes to say, I wanted to have you on to try to help us understand, first from a research perspective, from a scientific perspective, with well-controlled studies, solid outcome data, what sorts of mental health conditions specifically have psychedelics actually been showing good promise in treating?
Yeah, I like that question. And actually, I like to look at the psychedelic renaissance as more of a mental health renaissance or revolution of sorts, because I started my career doing clinical trials, looking for new psychiatric medicines, and I've done over 200 of them by now. And it was quite discouraging to see new medicines being explored, even coming on the market, that don't really push the needle until things came along came back, like psychedelic medicines, psilocybin for depression or end-of-life anxiety, for example, MDMA for PTSD. They are really transformative, if not like game-changing, in terms of helping people heal and grow and recover from these difficult conditions.
Well, now, you mentioned a couple of different there, and we've heard here in Canada anyway, and I don't know what this looks like elsewhere in the world, so maybe you can give us a bit of a global context too, but we've heard about ketamine being used, and ayahuasca retreats have become apparently very popular now. So what is the difference between all of these substances, other than chemically, and is there a matching that can happen? Are there certain compounds that are better for certain conditions?
Yeah, so the word psychedelic means to wander in the mind or mind manifesting. And it used to be limited to what we now call the classic psychedelics, those that trigger this blast of serotonin release in the brain, this receptor called 5-HT2A, and have a hallucination kind of effect, altered state of consciousness, if you will, an ability to see things from a different perspective. But then along came like ketamine, that's been around for a while as an anesthetic, but was discovered to have antidepressant properties and psychedelic properties, or a psychedelic experience along with it. And MDMA as well, which is more of an empathogen, like induces these feelings of trust and empathy and love towards self and others. And so those are now included in most people's definition of psychedelics. And basically they elicit this non-ordinary state of consciousness and create more like openness and flexibility in the mind that lets people accelerate the therapeutic process. And I guess to answer...
Yeah, please.
Oh, go ahead. The second part of that question is, can we match them? That's what the studies are doing. Like MDMA is being studied for PTSD and will go for FDA approval before too long as a potential prescribable intervention. And psilocybin similarly is being studied for depression on this FDA drug development path.
And what's been stopping this from happening in the past? I mean, there was my understanding, a ban on this kind of research for a very long time, right?
Yeah, that was an unfortunate time point in history that was mostly political and fear-based, because they were in the 70s, essentially, late 60s, early 70s, added to this Schedule I controlled substance list that made them essentially inaccessible for treatment and even research. So it went through this this dark age of inability to study psychedelics, in spite of the positive results. I guess they were, in many people's view, being used in reckless ways, or being promoted too overzealously, perhaps. But then coinciding with this much needed kind of mental health revolution, they're coming back, and the public perception has been very open, and healthcare's receptivity to it has been incredibly positive as well.
Mm. So what is the scientific research showing then in terms of all of these compounds, rather, with respect to dosing and outcomes? Because sometimes, and I've experienced this personally, you can be put on an antidepressant and it's kind of unfortunately, a set it and forget it kind of thing. You just got to take it for the rest of your life if you want it to work. And that's not quite the case here. So what are we talking in terms of dosing and duration of treatment?
Yeah, that's a good question. And looking at them individually, the first psychedelic to potentially get approved by the FDA for prescription or treatment in the US is MDMA for PTSD. And if you look at the recent data that was released by MAPS, the nonprofit that's pushing this forward, they released half of their phase 3 data, the big study that is generating the data for potential approval. And these were individuals with severe PTSD going into a study who got either MDMA or placebo. And the individuals who got MDMA plus therapy, I think it was 67% of them no longer even met criteria for PTSD, even months later. And so this is unusual for psychiatry. We have all too often, unfortunately, been left with medicines that treat symptoms and don't go for the root underlying cause or the cure. But yet here comes a medicine that helps people completely recover and not even have PTSD. The majority of people, compared to like maybe a quarter in the placebo group who got therapy without the medicine. So it is truly game changing in that regard. And then looking at the other ones, like psilocybin is showing a significant antidepressant potential with just 1 or 2 doses of psilocybin, along with therapy. And that's lasting. So as a psychiatrist, to be able to give someone a medicine once or twice instead of a daily pill and have it beat treatment as usual, that's incredibly inspiring to me.
And I think it seems to speak to, like you said, what those underlying causes of the conditions actually are. Because if the other medications are treating, whether it's the sadness or the lack of energy or whatever, that's all stuff that's happening because of the condition. But then it really, I think, calls into question what the condition actually is, if we can treat some of the underlying causes. And for me, it reminds me of a number of years ago in my TED Talk, I talked about my own experience with depression, with suicidality, and how it was like this cognitive rigidity or this collapse of sorts. But what I've been hearing for the treatment of most psychedelics is that it almost shakes something loose or returns you to a childlike state or potentiates in a way. Is that a fair kind of theoretical characterization of what might be happening?
Yeah, I'm glad you mentioned that example and shared that personal anecdote, because what you're describing speaks to the mechanism of how psychedelics are thought to work, especially something like psilocybin for depression. There's a theory that's being studied more and more coming out of Imperial College in London and others called REBUS, REBEUS, Relaxed Beliefs Under Psychedelics. And the basic idea is that psychedelics reduce the grasp of these tightly held past beliefs of being, say, unworthy or say a depressed mood state you're stuck in, allowing these thoughts and beliefs to be changed, and allowing the new sensory information to take precedence. So because in life we generate these mental models where our brain tries to predict what's happening, lays down these neuronal pathways, and they get layered on each other. Sensory inputs come in, sometimes they get changed, but sometimes we get stuck in that ruminating, self-defeating thought pattern or depressive state. And psychedelics come in and almost present a blank slate, this window of neuroplasticity to reshape those and go forward in a new way.
So now, it's one thing to tear down the old scaffolding, I guess, to allow something new to be built. But so much of this, I think, depends on set and setting, right? And on this idea that you can tear it all down, but nothing changes if nothing changes. If you're in the same environment, practicing the same habits, then potentially there's some risk there. So in that sense, what does a typical treatment protocol look like for somebody who might be curious about, say depression as an example, because I think that's the most common experience where this might be applicable. But what does that look like when somebody walks in the door to get this kind of treatment?
Yeah, that's a really, really good point, because it helps answer the question of why someone might not spontaneously heal from their PTSD or depression by taking a psychedelic at a friend's house or out in nature. There can be healing experiences spontaneously that way, but there's so much involved in the set and setting that, like you mentioned, because psychedelics are thought to be these amplifiers of what's going on in our psyche, or they just present this window of opportunity where you can more consciously lay down new pathways and chart a new course. So a typical protocol for depression involves preparation sessions. A couple times we meet with the client to get ready for the experience. Like, what is the treatment plan? What's their intention? What are they hoping to get out of this? And what should they expect and do to prepare? And then on dosing day, you come in, take the medicine, a good sized dose of, say, psilocybin. That's a psychedelic dose. We hold space for them for 6 hours, two therapists sitting there. And as they do this inner work, with some interaction, but a lot of it takes place inside. We rely on what we call the inner healing intelligence. And then next comes integration sessions. So there might be a couple integration sessions after that, an hour and a half each time, making sense of what happened, drawing insights from that into daily life. That's what's missing in people's like recreational use, in addition to the set and setting. And then for depression, that might be it. Sometimes there's just one dose. If it's two, then it's the same kind of protocol. For PTSD, it's often 2 or 3 sessions with MDMA combined with like 40 hours of therapy.
Yeah, I think that therapy piece is so key. Now, what are the contraindications here? I mean, is there a risk of a bad trip? I'm not sure there is such thing as a bad trip. There's good ones and learning ones, but or they're all learning ones. But are there people for whom this might not be the best type of treatment, where you might want to approach it a different way?
Yeah, no, it's a good question, because you do have to approach it with caution and make sure we're not only using it for the right purposes, but that the individual is ready for that and has the right support. There are some conditions where we just don't want to use psychedelics, like if someone has psychosis or mania, we might worsen those conditions. Or if they've had those in the past, we would need to proceed with extreme caution. Otherwise, we also keep in mind that sometimes you might feel worse before you feel better. Sometimes it might bring up past traumas, and there does need to be that therapy on board, or that willingness to do the work and see it through to the other side of that difficulty, because sometimes the only way out of that difficult place is through it, and with the as much support as we can give an individual.
Now, this still seems only like in the last few years that this field has really been exploding commercially, at least in Canada, as I've mentioned. So what's the future of psychedelic treatment? Is it starting to actually penetrate into psychiatry and psychology and that side of treatment, or is it still exclusively private healthcare?
Well, we're seeing it show up in not only private mental health clinics, in both psychiatry and psychotherapy, but we're seeing it in academic institutions that are coming on board, not only doing the research, but rolling out programs like ketamine-assisted psychotherapy, for example, that is a powerful tool in and of itself for depression and other conditions, but it also helps pave the way for what's coming with MDMA and psilocybin presumably becoming treatment options in the next few years. So I've seen it change already with not only ketamine being used more and more in mental health, but Spravato, S-ketamine, a nasal spray that's ketamine derivative that was approved in the US in 2019 for treatment-resistant depression that we've given probably 10,000 doses of since it came out then, all covered by someone's insurance to help people with severe depression where all else failed.
And I think that's the key idea. Sometimes when you feel like you've tried everything, especially now, there's always new things worth exploring.
Mm-hmm.
Dr. Reid Robison is Chief Medical Officer at Novamind, a Toronto-based mental health company focused on psychedelic research and treatments. Thanks for being here, Reid.
Thanks for having me.
This is the Lifeworks Living Well podcast. I'm your host, Mark Kennick.
In our changing world, there is an unchanging principle for success that inspires us. By improving a person's life, we'll improve how they perform at work. We are Lifeworks. We are the world's leading total well-being provider. We are innovators with tech-enabled solutions. Our mission is to improve people's lives by supporting the whole person, their mental, financial, physical, and social well-being. These people are the heart of successful organizations, leading these organizations to a more resilient future and making a real difference in the world and in our communities. Improving lives, improving business. We are Lifeworks.
Dr. Tim Sharp, aka Dr. Happy, is the founder and CHO, that's Chief Happiness Officer, of the Happiness Institute. He joins me now from Australia. Dr. Sharp, thank you so much for being here.
Thanks for having me.
So I want to dive right in to get a little bit of an operational definition of what happiness is. I mean, we've been talking about defining happiness for millennia, I think, of philosophy. What's Dr. Happy's definition of happiness?
Well, you're right. It's an age-old question. And in fact, whole PhDs and textbooks have been written about it. So I'll give you the very, very brief version, or two brief versions, actually, because I think there's two simple ways we can understand happiness. The first is probably the most common way that most people think about it, and that's as one form of positive emotion. So there's a whole range of positive emotions, including joy and excitement and love and satisfaction. Happiness is one of them. And, they're good things to have in our lives. We want to have positive emotions in our lives. But what positive psychology, the science of thriving and flourishing, is really interested in, and when, I suppose, to be honest, when I mostly talk about happiness, what I'm talking about is living a good life. So that means not just how I'm feeling in the moment, but taking everything into account. How satisfied am I with everything I have or don't have, etc. So that's a broader definition, probably a deeper, more meaningful definition, and it includes a whole range of concepts above and beyond just the positive emotions.
Now, every now and then, especially in psychology, it seems, and in science more generally, a concept catches on, it becomes really popular, media love to report on it. And I feel like one of those over the last year or two especially has been this idea of toxic positivity. So tell me a little bit about, or I guess compare and contrast for me, what toxic positivity is versus real happiness, and give me a sense of what that actually means.
Well, I think the name itself kind of gives it away, especially the first part, the toxic part. I guess it's when a particular attitude or approach becomes toxic or unhealthy, unhelpful. And what people are really referring to there, or in my opinion anyway, is when the beliefs and expectations around happiness become so unrealistic that people are kind of setting themselves up for failure. So to give you a slightly more specific example of that, I guess, it's the idea that you can be happy all the time. Now, that's just rubbish. It's patently absurd. Again, it's an unrealistic goal. No one ever will be happy all the time. No one should expect to be. But there are, I think, a relatively small number of people who maybe promote that idea on social media, saying you can do anything, you can be happy all the time. And the reason some people are concerned about that, and I'd be concerned about it too, is that, again, if that's your goal, you're destined to fail. And what that can mean is disappointment and frustration, which is not what we want, I suppose.
Well, no, but I want to unpack this a little bit further, because I find that we set up straw men enemies almost, just so we can easily knock them down and make our own field look credible, maybe. And I have this sense, maybe it's just me, that level, that's oversimplified level that the concept of toxic positivity represents. I've never really seen it like that in nature. You know, people are complex. I feel like people really do want to do their best. They want to help other people, generally speaking. And they often just don't know how, or maybe what they're saying gets misinterpreted. I've even heard, you know, people say all the time, don't tell me to just go do yoga. If I could just go do yoga and that would make me happy, I would have done that long ago. But then again, on the other hand, there's good evidence to show that doing yoga could help you be happy. So part of me wonders if it's a caricaturization of people who are making those suggestions, or if there's something happening on behalf of the unhappy person too, that's oversimplifying some of the advice that's being given.
Yeah, look, I 100% I agree with everything you said, pretty much. And look, I don't think you'll ever hear any I guess people that I would consider experts, people with qualifications and expertise in the area, I don't think any of them would ever be accused of toxic positivity. Most of them, provide a subtle, sophisticated message that includes, all the nuances of the good and the bad and the tricks. And however, that being said, those of us who maybe are expert but are also present on social media can fall into the trip. I mean, social media, by definition, almost requires a short, succinct, oversimplified message. And I've been guilty of that, I suppose, in my time. I mean, despite, I'd like to think that I'm qualified and expert in my area, but, when you're posting a tweet that has a couple of hundred characters, or even an Instagram post or whatever it might be, you can't, by definition, include all the subtleties of all the research. So I think you're right. I think it's a very tiny minority, and I think most of them are probably just kind of victims, for want of a better word, of the sort of social media trap that we can fall into. But that being said, I think there are some, I guess what I'd call unqualified, rah-rah motivational type speakers who are sometimes trying to spruik something or sell something. And there is a risk that can sometimes, as I said a bit earlier, set people up for failure, or provide unrealistic expectations that are not entirely healthy or helpful.
There was a report on that actually fairly recently here in Canada about life coaches in particular, how it's an unregulated profession, and very often people will get into it with no particular training in psychology or how to work with people, and people have been harmed as a result. So I think there's a good case there for the regulated practice of psychotherapy in particular. But I want to get back though to then what the fundamentals of happiness actually are. What do people need to be happy?
Well, look, again, I'll preface this by saying that, again, theses and books and textbooks have been written about this. So, I guess the risk is that in a couple of minutes I'll be oversimplifying things. But that being said, we do have a lot of research, and there are some basic fundamentals that will apply to most of us most of the time. I mean, the other caveat is that we're all different. So what ultimately works best for me might not be exactly the same as what ultimately works best for you or someone else out there. So we all need to individualize or tailor this to suit our own personality, our own life, our own goals, etc. But again, that being said, there's good research, and there are some common themes that come up time and time again. And they're, in very simple terms, the things like enjoying as many positive emotions as possible, but also accepting the so-called negative emotions. I mean, that's an important part. So emotional regulation or acceptance of the distress in life is actually an important part of happiness. Accepting that it's okay not to be okay all the time is important. If we try to fight that, it can actually cause more distress. So that's one of the things that's important. One other thing is understanding that happiness, in the truest sense, or certainly as I refer to it, goes beyond those momentary or fleeting feelings that we have. And by that, I mean, one of the things that we know contributes to a good life is setting and working towards meaningful goals. Now, as any of us who work towards a meaningful goal knows, it's not always fun, not every minute of every day. If you're training for a marathon, if you're writing a book, if you're working on a project at work, Sometimes there'll be days or there'll be moments when it's difficult, when it's challenging, when it might be frustrating. But ultimately, we know that if we work through those things and get to the end, whatever that might be, or complete the project, whatever that might involve, that sense of satisfaction, that sense of accomplishment is a really, really important part of what I would call happiness or living a good life. One of the other bits that's really important, that sometimes kind of gets a bit ignored or sort of put off to the side in a sense as a separate area, is our physical health and well-being. You know, we often think about, quite rightly, I suppose, we think about happiness as a psychological or emotional phenomenon, which it is, but we also know that our physical health and well-being is intricately enwrapped, with our psychological health and well-being. And we know, just for example, things like exercise, which are wonderfully important and beneficial for all sorts of reasons, but exercises are not just good for our bodies. They are, it's good to be strong and fit and flexible, but exercise is also a potent antidepressant. It's a great stress buster. So it's just as, if not more beneficial for our psychological health and well-being as it is for our physical health and well-being. And and then there's other things like healthy diet is important, good sleep is important. So that physical aspect, I think, should be seen as one and the same in a sense as the psychological aspects. And then, look, I could go on and on, but just one other really big gun, I suppose, probably the biggest gun in a way. And if you look at all the research over all the different components of psychological health, the top of the list, or at the top or near the top of the list, will almost always be a version of good quality relationships, a sense of connectedness, of belonging. So we know for a fact that real happiness isn't just about me. It's about us, I suppose. Look, I do need to look after myself. We all need to take responsibility for our lives. So it's partly about me, I suppose. But again, we know from the research, one of the most important factors is, loved ones, friends, colleagues, feeling like we belong, that we're part of a community is super, super important for our psychological health and well-being and for our happiness.
Do you think, Tim, that happiness is learned? Do we learn how to be happy?
A big yes, but partly a yes-no. And by that I mean that some people will definitely find it easier than others. There's no doubt there are genetic contributors probably to some extent. There are very early learning, early lifehood events that can significantly influence that one way or the other. So I suppose, there are some people who, because of their genetic makeup or, their hereditary, their family background, will find that happiness doesn't take that much work at all. And look, for anyone out there, if that's you, then good luck to you. That's great. But the good news is that if you're not like that, for whatever reason, and there are lots of reasons, you can learn it. So that's really, really important. That there are strategies and the things I've talked about already. You can learn to take better care of your physical health and well-being. You can learn to set and work towards meaningful, achievable goals. You can learn to connect better and relate better and interact better with other people. You can learn to be more optimistic and hopeful and more grateful. So that's why I said a big yes. There's no doubt that if you know what to do, and if you're prepared to maybe put in a bit of work and practice it, just like you've got to go to the gym to get your body fit, I suppose, that there are significant benefits. You can actually enhance your happiness and quality of life if you do the right sorts of things.
Yeah, and like learning anything new or that you've been kind of out of practice with, because I think you do need to practice happiness just like anything else, just like working out. It's probably going to be a little bit awkward, difficult at first if you haven't done it for a while, and to be ready for that. I experienced that myself in my own recovery from depression and in writing my own book, that how so much of my recovery was invested in taking all the same things, all the same traumas that had happened to me before, and practicing doing something else with them, telling a different story about them, what they were for in my life. And I think for me personally, that was really healing, to be able to say, well, this happened. There's nothing I can do about that. I might as well do something with it instead. So I think that's one strategy that's been helpful for me, that re-narration. Is there anything else that you can recommend for people who are trying to get out of that either anhedonia or active unhappiness, that some steps that they can take?
Yeah, well, look, you've made a really good point that it is very important to be realistic. And I guess this goes back a little bit to that toxic positivity idea that, you can't just snap your fingers and magically change overnight, or not many of us anyway. Again, if you can do that, good luck to you. But for most of us, or most people, we know from the research, and again, I've had several decades of experience as a clinical psychologist and then coach and consultant. But, for most people, it does take time. So, you do need to work at something. You do need to persevere, and you need to keep doing it. And again, I go back to that metaphor I often use, with our physical health and well-being. Most people would understand that if they wanted to get stronger, for example, they'd need to go to the gym. Not just once. You can't just do it once and be strong for the rest of your life. You've got to go, every day, or at least 3, 4, 5 times a week, and keep going next week and next month and next year. Well, it's the same with our psychological health and being. I mean, you can't just practice gratitude once and expect your life to change. You need to do it on a daily or weekly basis. You need to connect with friends on a weekly, a daily, or regular basis. Or else any benefits you get initially will quickly fade away. So, I guess that's what I'd say. A lot of people, or some people, also give up too early. They try some of these things and think, oh, it hasn't worked, or it's too tricky. As you said, it will be challenging to begin with. That's just the nature of the beast with any new habit, any new behavior. But if you stick at it and fine-tune it, and as I said, individualize it, modify it to suit you, then over time, and not necessarily that long, but over time, it'll definitely be worthwhile. And eventually, I suppose, it becomes part of your normal life. So it becomes easier and easier.
Yeah, you acclimate to it, that central tendency. I love that. Dr. Tim Sharp, you're the founder and I want to get this right, CHO, Chief Happiness Officer. Every organization should have one, I think, at the Happiness Institute. And you're joining me tonight from Australia. Thanks so much for being here, Tim.
Thanks for having me.
This is the Lifeworks Living Well podcast. I'm Mark Hennick. We'll be right back. We're almost out of time, but I'd like you to hear from just one more person. Lori Deakin is Senior Director of Strategic Partnerships and Practice Excellence for Lifeworks. Lori, thank you for being here today.
Thank you so much for having me, Mark.
Now, Lifeworks has a robust absence management and disability management program. Tell us more about that.
For sure. So we have an absence disability management program that focuses on employees who are actually off of work. So a lot of you are probably similar, and you know that you have short-term disability management. Well, that's what we do. We do short-term disability accommodations, intermittent absences. To dive into that a little bit further, what it means is that intermittent absences are for those individuals who might be struggling at work and might be missing every Friday or every Monday, or maybe missing things randomly. And we come in and we help out to find out what's actually happening with these individuals. We have consultants, we have nurses that can come in and really find out what's happening. Then we also have accommodation claims. So let's say someone has hurt their leg and they're going back to work and they need to have an elevated chair or they need to have a specialized footrest. We can come in and also assess that. But then our biggest block of business is actually from a short-term disability perspective, where we have case managers who are in charge of your file, and they actually manage them. And it can range from colds, cancer, arthritis, physical conditions, and most importantly, mental health. Unfortunately, our biggest block of business is mental health. So we see a lot of cases come through from that regard, and we do have people who are specialized in mental health claims to actually support people in their journey through their disability. We make sure that we're assessing the medical information, the restrictions, limitation, the treatment, and the prognosis, and then we help them get back to work in a healthy manner by working with employers and then also working with their attending physicians as well.
Well, that's just it. Taking time off of work is a tool that's available to you. Sometimes people need to do it, but we also know that people do better when they're at work, when they're supported at work. So this sounds like an incredibly useful support system. Thank you for telling us about it. Where can people learn more if they're interested?
People can actually go to our website at lifeworks.com and find out more information there, or they can talk to their employers as well, because we do have a lot of ties with employers. So that's where you'd be able to find the information.
That's great. Lori Deakin is Senior Director of Strategic Partnerships and Practice Excellence for Lifeworks. Thanks for being back on the show, Lori.
Thank you very much.
That's it for us this week on Living Well. Thank you to all of my guests today, and thank you, as always, for listening. You can like and subscribe to Living Well wherever you're listening or watching today: YouTube, Apple Podcasts, Google Podcasts, Spotify, and everywhere else the podcasts are found. You can go back and get all of our past episodes from our 3 seasons so far on any of those platforms, as well as at livingwellpod.com. You can connect with me directly on Twitter, Facebook, Instagram, LinkedIn, and YouTube at Mark Hennick, and let me know what you thought about our conversation today. Until next time, this has been the Lifeworks Living Well podcast. I've been your host, Mark Hennick. Take care and live well.